Hi, everybody. Welcome to your Baby's Brilliant Brain podcast, our special episode on YouTube. I'm Dr. Christine Anderson, and my patients call me Dr. Chris, and with me is
Dr. Toxel Ruck.
And
we're
call you Dr. Toxel, right?
Sure.
Yeah. And we're coming on today to help you optimize your baby's brain health and development from conception through the first few years of life, which is why we're talking about fertility today and talking about that perfect egg meeting the perfect sperm so that you can have that best combination to start with, like having an optimal blank canvas, so to speak. And if you are joining us live, you can say hi. We've got this live stream going through StreamYard so that we can, see if you have questions, just type them in. We're going to be able to see them so that we can answer those questions. So,
exactly.
Yeah. How do you want to start this, Dr. Toxel?
Well, how do I want to start?
Well, how about if I start then? Let's just talk about some of the facts of fertility.
I was going to mention it's becoming more and more of a challenge, I'm finding, for some women to get pregnant. There are so many things going on in our environment now that we're told to watch out for. It can seem a little bit overwhelming, but we're going to streamline it as much as we can to give you some good information today to think about and look further into. So yeah, absolutely. Because Dr. Chris has had personal experience with, actually being pregnant, being a mother, I'm going to let her kick it off.
Well, I just wanted to share some of these statistics with you. I'm not a big numbers person, but I think it's really good to know kind of what we're up against. And it doesn't mean that it's futile, but it just puts everything into perspective. And these are 2018 figures because they haven't come out with ones for 2020 yet. But I think it's the National Health Statistics or something like that. And they said that the total fertility rate is 1.7, somewhere around there. It's between like 1.72 and 7.5, something like that. But this is really alarming because...
Well, what's that basis? 1.7. What does that mean?
That's the number. That's the total fertility rate.
Okay.
That's the rate people are able to get pregnant and take a pregnancy to term. There's also what happens as far as you can get pregnant and have it to term. But in general, 1.7 is this number. And here's the alarming thing. The replacement value, the total fertility rate, it needs to be 2.08. That I know for sure because I'm like 0.8. Okay. How do you have 2.08 children? But whatever. So it's below what the replacement value is that we need to have in order to replace us as a population. So this is alarming in what is happening. And this is a downward trend for a good 50 to 70 years. And even looking ahead, that trend is going to continue to go down.
Which is a little alarming for me, being on the cusp of looking to have children at about, the age of 29. Women are having children older now, which, not to say that means anything, just taking into account with those statistics as well, what's been changing in our modern society, the way that we do things socially. A whole bunch of us are not just getting pregnant at 18, 19, 20, not that early. We have other things that we want to do before we consider having a family sometimes. So the older, though, that you get, the more that, the more things that life tends to throw at you, the more things that your body comes into, contact with, whether it be the environment, certain things that stress you out. So there's a lot going on to talk about in terms of fertility, especially because in general, the population is having children a lot older than they were even like 10 years ago.
Sure. And so then that cuts down the amount of time that you have for your reproductive years. And these things that you're exposed to, even as a child, are super important because women are born, or girls are born, with all their eggs. And most people don't realize that. And we're born with a lot, and then they start to actually mature and get old until we're only left with a certain amount that we have to work with for our 30, 35, 40 years. So those eggs, how young they stay, are dependent on what we do as we're growing up and as an adult. So this is more of the epigenetic lifestyle aspect. And these are the things that we have in our control. But it also is something to think about as you are prepping your body to be pregnant, because if you have a girl, then you are going to be developing her eggs in utero. So anything that you come in contact with is going to affect her children or your grandchildren. So this is really something that I like people to start thinking about early on. If you are a young woman, or if you are thinking, well, I want to have children, but in the future, or years from now, 1, 5, whatever, now is actually the best time to start prepping for your children, because the longer time you have to prep and get your body into balance, the better the situation is going to be, not only for getting pregnant, but keeping pregnant and having a baby with the best health. Now, there's no guarantees, but these are the things that we have in our control.
Right. So I think just to get a good start in this whole entire topic, most women don't understand how the menstrual cycle works. So of course we become, quote, fertile when we have that first menstruation.
No, they're too busy cursing it.
Well,
only kidding.
That's another
Sorry.
That's another topic.
Sorry, I didn't really have trouble with my menstrual cycle. I know a lot of women do, though, and maybe definitely another topic. But yeah, why don't you dive into what this is all about?
Well, so basically, there's certain stages that happen, and it's supposed to happen monthly. The average is about 28 days of a optimal menstrual cycle to happen. However, you are only typically fertile, sorry, sometimes I pronounce things weird, fertile for 24 to 48 hours of that portion of the cycle. So the window to actually have an egg come into contact with a sperm to fertilize it is not as big as some people think. And it's not that you can't get pregnant if you miss that exact window. It's a bit more complicated, but the actual ovulation period is way shorter than people think. 48 hours is actually quite a bit of time. So you start out, if you're going to count when your cycle starts, it's whenever your previous menstrual period stops. So you start counting day 1 after your cycle completely stops, your bleeding stops.
Day 1 is the
day 1.
First day of bleeding.
Sorry, it is. Yeah.
That's all right.
Sorry,
That's what I'm here for.
I've had a little bit of a distraction just come in recently.
Oh.
Yeah.
I can't wait to hear about that. Anything you want to share with us?
No. Nothing like that. Nothing like that. It's more. Yeah.
So anyway, let's get back to it.
That's what I meant. Day 1 is when you start bleeding.
First day of your period.
First day of your period. What I was thinking of was actually, so you actually really want to start counting day 1 on your first heavy day. The funny thing is, those little spotting things that you see are actually your old that's your old cycle depleting itself of the menstrual blood.
But that is old. That's old blood. And we talked about this with Rosita about that not being optimal. So if we're talking optimal, your first day of your period is when you're new blood is being released. So if you have old blood, go back and listen to our podcast on the Arvigo techniques of my abdominal massage.
The reason why I wanted to bring that up was because it can be important when your actual day one is. So sometimes when people see that spotting first, that little bit of old blood, they start thinking that's actually day one. And the funny thing is, then that throws the entire count off because there are stages. So the next stage coming up to ovulation is about 7 to 21 days. It can be 7 to 21 days.
From day one?
From day one, yeah.
Optimal would be around the 14 days average, plus or minus. Sure. So while Dr. Toxel goes and takes care of the distraction, I'm going to just come in here. And so on around day 14 would be your ovulation. That's when an egg is released from the follicle in your ovary. And then you are going to have a switch in hormones. So first we start with the estrogen releasing the egg from the ovary. And then you're going to have a switch of progesterone being produced from the leftover, called the corpus luteum, from the egg being released. And that's going to start the production of progesterone, which if you get pregnant, it continues doing that. But just in the cycle phase, we're going to talk about menses. And then you have a crash down of progesterone and estrogen right before your menstrual period will begin. And again, that's about another 14 days if we're looking at the average time of a normal menstrual cycle. So yes, that can vary, but this is what we're going to look at as being optimal. Anything you have to add to that?
Right. And so, as I said, there's certain, as you can see, there's a lot going on during the menstrual cycle. So a lot of different hormones are coming into play at certain times to trigger certain events that happen. And then, so basically though, the thing is, your ovaries kind of dictate your menstrual cycle. Those are the key players. So when we're looking at fertility, I look at ovary health. It's very, very important because those are going to set the stage for it. So the thing is, it actually takes 120 days for a follicle. So follicles are these little pockets which your eggs are sitting in your ovaries. And that's the official name for it. I didn't make that name. So the follicles end up maturing from a dormant state to ovulation over the period of 120 days. That's actually 3 months. So if you've had a particularly stressful period or a particularly bad period, dysmenorrhea, for example, or very irregular, you actually want to go back to what the state of your health was 3 months before that period, if you can even possibly remember.
Just to build on that, because it's a really good point, I have women coming in all the time who want me to help them work with their fertility. And I say to them, give me a good 3 months to help with this balancing of your body. And this is because of the fact that that egg maturation in the ovary is going to take about that amount of time. So it's a process when you get to the aspect of healing, and this ovary function is dependent on the brain, believe it or not. The brain is dictating really the whole show, and the pituitary gland is the thing that makes our bodies react. So the FSH,
master gland.
Yes, FSH, or follicle stimulating hormone, and another one called the luteinizing hormone, or LH. These are the things we look at to make sure they're in the optimal range. And if you are getting on in age and you want to see if maybe you're headed towards menopause, this may be the first sign that your system is switching over, because what happens is that the pituitary will produce these hormones, the ovary isn't responding, and then the pituitary thinks it has to yell at the ovary, And then it has to make more follicle stimulating hormone and luteinizing hormone. So you'll see a rise in those values. And that's another thing I look at when women come in, because if those numbers are increasing, that's letting them know that their window of time is decreasing, or we've got to work on their pituitary health and brain health. And this is part of what we do as chiropractors as well.
Right. And so now when we're looking, speaking of hormones, that brings into play some things that we have control over. So the birth control pill, it's synthetic hormones. Pills are ethinyl estradiol. So it's not real estrogen, it's synthetic estrogen, and it's also a progestin. So these are synthetic hormones that suppress your ovary function, because it is your ovary that needs to expel that egg. So, when you're on birth control, understandably, you're not trying to have a child right now. Fine, but you've got to understand that when you're introducing this synthetic hormone into your system, sometimes when you go off the pill, it can take a while for those hormones to come back into balance because they've been shut down for so long. So, it's got strong synthetic estrogen that does other things in your body, but it overrides your own hormones. And so that's where, some things can happen. Now with the birth control pill, because it's progestin based, it can actually prevent the formation of cervical mucus. So this is something that comes into play obviously during fertility. The cervix produces a mucus that actually makes the vagina a better environment momentarily for sperm to come through.
Yeah, it actually, sperm normally only lasts a few hours. Mm-hmm. But with fertile fluid, the sperm can actually last about 5 days. So right. It's one of the things that actually will enhance your fertility. And we'll talk in a minute about how to actually be more aware of this fertility aspects, how you know if you're ovulating, how you know if you're fertile. And I'll talk a little bit about that fertility awareness method in a little bit.
Right. And so the other factor of the birth control pill is because it's messing with your hormones, it can kind of mess with that follicular phase. You can have rises and falls of estrogen because of this. So oftentimes you can be producing cervical mucus as well, but you're not actually ovulating. So cervical mucus in itself, it has a different consistency. It's something that you might hear about when you are checking to see if you are fertile, which again, we're going to go into.
Should we just talk about it now? I mean, when you're fertile.
Yeah, I guess.
Yeah. So there's a couple of things that you can do with the fertility awareness method. One of them being taking your basal metabolic temperature first thing in the morning before you get up. It's a special thermometer that has very small gradients of degrees. So it's unlike a thermometer to tell if you have a fever or not. It basically is around 98.7, and then it kind of goes up from there in very small gradients, so that you can plot this. And when you're about to ovulate, or when you are ovulating, it's going to spike up high. So that's going to be your first indication you're ovulating. Those ovulation test kits only tell you that you have ovulated. Remember, you only have 1 to 2 days. So if by time you do an ovulation test kit, you might be at the end of that 2-day period, whereas if you're checking your temperature, you can catch it sooner rather than later and have a longer working time for this. And then
would this be useful for someone with an irregular cycle too?
Well, absolutely, because it's something that, again, if you are thinking of having children and you want to really take charge of your fertility, which, by the way, is the name of a book that I think everybody should be reading if they are female, and for sure if you want to be pregnant, or if you're looking at a way to have a birth control method that is not using synthetic hormones. It's not foolproof, but again, this is giving you a way to see what your body is doing in a very non-invasive and very cost-effective way, right? There's so many women spending so much money on reproductive help, and they come in to see me after the reproductive specialist has not been able to help them. And I just say, well, have you been tracking your fertility, or did they have you do this? And no, they didn't. So I thought, well, how do they even know if you have an ovulation issue? Because that's going to be, if you're seeing you're ovulating earlier or later, then and you're having sex at the wrong time, well, strike one, right? That's not going to work, the mechanics of it. So this is a really great way to know that you are ovulating. And then if your temperature rises and it stays up, it's the very first predictor that you are probably pregnant. So this is another way that you can learn very early on if this is basically taking, right? Okay, we've got a high temperature. It's also a way to tell if maybe a miscarriage is imminent if the temperature falls after it's stayed up for a while. So you can get so much great information just by taking your temperature. And then, as we said with the cervical mucus, you're just going on up using 2 fingers, grabbing some cervical mucus, and then trying to stretch between your fingers. The stretchier it is, then that is fertile fluid. So there's, a little bit more to it, but that's the general. And the third way, which is optional, not many people do this, and it's a little bit confusing, but you can actually go up and feel your cervix. And if your cervix feels more like your lips than your nose, so it's softer, then that is also a way to tell if you're fertile. And also the opening will be open as well versus closed. So very simple method, but you can gather a lot of information over time. And again, we're talking about, hopefully we're having enough time to be able to garner this information. So rather than trying to get pregnant and it being over a year, which is the definition of infertility, is having unprotected sex for 1 year and not being able to either get pregnant at all or maintain the pregnancy. So why wait? Why not just start doing it right away and actually see what your cycles are doing? And then you'll have something to work with. And even if you do end up using a reproductive specialist, then you have more information with which to go through, because otherwise, they still may do what they do, which a lot of times is just give you some Clomid and see if they can shock the ovary into releasing eggs. But I've seen that disrupt the hormonal system so much, especially if a woman is close to menopause. I've seen this personally where it has shocked the system into menopause by having a trial of something like Clomid, which is what reproductive specialists do to make the ovary release eggs. So that's my take on that. Anything to add on that, Dr. Toxel?
Well, I have a lot of things to add in terms
I'm sure you do.
Well, so the reason why we're focusing so much on hormones is because hormones are this amazing feedback system. And it's we don't even have to think about like, okay, it's time to uptick estrogen so that, our uterine lining builds and gets, or decreases, or, release progesterone. We don't think about this. Our body just does it. And so the other thing with hormones, though, is that it's not a singular system. It's not like all of the hormones, involved in menstruation are completely isolated from what's going on with other parts of the body. Same thing with your adrenal glands, the hormones that everyone has heard of, like cortisol and, insulin from the pancreas. So it's like, they're not isolated systems, though. If any of your hormones are out of sync with the body, it can lead to a cascade of affecting other hormones down the line. And so again, this comes back to the birth control pill. If this pill is interfering with your actual expression of certain hormones, it can lead to other things, and then just becomes this cycle, this circle of problems needing to address, especially if you are having fertility challenges.
Did you ever consider taking the birth control pill?
Well, I looked into it, because it's such an easy thing.
Yeah, sure.
But here's the thing. I already had, I had acne growing up, so already hormone imbalance, right there. Could the birth control pill have fixed it? Sure.
Well, maybe.
Well, no, we found out actually. So just a personal thing that happened with me. When we did the hormone testing, it was actually discovered I was making so much estrogen. But instead of keeping it in the function of estrogen in my body, like with some women where, you have high estrogen signs and symptoms, my body was actually converting the excess estrogen into testosterone,
right? Which
big contributor to acne.
Absolutely.
The thing is, birth control pills, it's synthetic estrogen and a progestin usually. So I don't know what that would have done to my body, given the fact that I was already making too much estrogen, real estrogen. But, I did other things, re-regulated. Face is a lot better. So,
right, because you can help manage those hormones naturally.
You can, and we'll talk about that. I think you should talk about that later because you've gone through that entire process. But the thing is, and I was looking through my notes.
You didn't ask me if I ever considered taking birth control.
Did you?
No. But here's the thing. I had no clue, right? I didn't have a mother who was into natural health and healing. I mean, we did okay, but I grew up in a very conventional family without any alternative therapies. So I didn't really have any clue, but for some reason, my very young self, not too young, just the right amount of young, said, because I really didn't have any problems with menstrual cycle or hormones or anything like that. But my very way back brain said, I don't know, this doesn't seem right to monkey around with my hormones. Like, really, I don't think this is a good idea. So I never did. Thank goodness. I mean, I would have hate to have messed up my hormonal system when there was really nothing going on. So,
right.
All right. Sorry, I didn't mean to interrupt you. Go ahead.
No, it's okay. Well, and I wanted to talk a little bit about, so the key point of ovulation, egg is released from the ovary. Egg travels down the fallopian tube. If you want to listen to our Mind Abdominal Massage episode, where I learned that the opening where the fallopian tube connects to the uterus is like the tip of a needle. Wrong way. Tip of a needle. Big.
That's a little bit bigger anyway.
Yeah, I know it is. Yeah. I can't make it that small.
It's super small.
So that egg actually usually gets fertilized in the fallopian tube. Now the egg needs to travel down into the uterus and then implant itself in the endometrium, which is the innermost lining. That's what sheds every month when we menstruate. But if the egg successfully implants in that endometrium, it kicks off another hormone cascade. So different things happen. And this is where we talk about the luteal phase in our cycles. So this is usually about 14 days long. If you're not pregnant, then at the end of the luteal phase, that's when you would start menstruation again. If you haven't fertilized, if you don't have a fertilized egg implanting itself, and then the whole thing kicks off again. But if that egg is fertilized, what happens is basically your follicle, so that little pocket that was holding the egg in the ovary, starts restructuring into a different gland called the corpus luteum. That starts secreting progesterone. So the main thing to take away from this is in our cycle, that is the main way that women make estrogen and progesterone. Those are our main actually, I think that is the only other way that we get our estrogen and progesterone.
We do make some estrogen from our body fat, by the way.
Oh yeah, but
that's a topic. Well, it can be a lot depending, and this is where something like PCOS comes in, which is one of the causes of infertility.
And we'll get into that in a moment, because I just want to finish this general
for
thought.
sure.
Yeah.
And just to kind of build on what you were talking about with the luteal phase, by the way, that has to be at least 10 days long. If it is not 10 days long, this is not enough time for implantation to take place and that follicle to change over to the corpus luteum. So that's going to affect the production of progesterone until the placenta takes over. So this is why this is another crucial thing with the fertility awareness. So that with that temperature rising at ovulation, you'll be able to see it has to stay up for at least 10 days. If it drops too soon, that's a trigger or something for you to know that that's too short.
Right. And so this matters, of course, because you need progesterone to be secreted to keep the pregnancy intact. That's where that corpus luteum comes in. It's going to secrete progesterone until the placenta can take over. It's the final stage of the 120-day maturation of that follicle and, that little part of the ovary. So it actually super important. Now, the thing is, the formation of the corpus luteum, so the thing that's going to help that pregnancy, that fertilized egg, continue into pregnancy, can be impacted by inflammation. It can be impacted by thyroid disease, insulin sensitivity, as well as nutrient deficiencies like cholesterol, magnesium, vitamin D3, which is a huge one I'll be talking about later, B vitamins, iodine, zinc, and selenium. As I said, these are not isolated systems. There are other things that can go on in the body that can impact this egg becoming implanted in the uterus, and then that corpus luteum expressing progesterone, which keeps that egg intact, again, until a placenta is formed, which will then take over for the secretion of progesterone, which keeps the pregnancy. So here's the thing with birth control. When you're on the pill, you don't have ovulation, therefore you don't have a corpus luteum, and you don't have a luteal phase, and you don't have progesterone because of that. Again, you need progesterone to keep that pregnancy, and this is why becoming pregnant after getting off the birth control pill can be so difficult, just to put that into context.
And it can even take years.
Right. And I actually know one person that got pregnant right off the bat after getting off of birth control. So again, this isn't for everybody, but for people who are experiencing difficulties after getting off the pill and trying to get pregnant, this could be one of the reasons why. It's, again, messing with the formation of and the expression of the ovary hormones that need to happen in order for a pregnancy.
So I tend to say, if you know you want to get pregnant, try to get off of birth control about 2 years before you want to start really getting yourself into balance to conceive. What do you think about that?
I think that's good. Now, if you don't want to get pregnant right away, obviously, condoms are a great alternative.
There's definitely other alternatives, but
and that's where, if you're getting pregnant in the way where, biologically there's sperm insertion and all of that. But in general, if you are trying to get pregnant, that 2 years gives you time. And I would say it also depends on how long you've been on the pill. Now, if you've been on the pill for like 10 years, which is a possibility with younger and younger women becoming, reliant on birth control for issues such as acne and weight. I've heard them using the pill for all sorts of issues. So some of these women have been on it for 10 years.
Well, I think 2 years is a good amount of time if you can. I mean, obviously, the sooner the better to start working on fertility. Like I said, now is the right time. But what do you think? Should we get into some of these causes of infertility? Yep. I think we should. Well, and by the way, we're talking, right. It's a big cause. It's a huge one. We're talking right now about females, but actually, let's just take a little detour to males for a second before we go and finish up with females, okay? Because here's the thing. It takes two. It does take a sperm no matter what, even if you're doing this in some other sort of way, but it takes a male, right? And with infertility, a third of the time it's due to the woman, a third of the time it's due to the man, and a third of the time it's going to be due to either both or just unknown factors that they can't find. I love those unknown factors. I love when people come in and go, I can't find anything. I'm like, great. That means that all of the pathologies and the problems have been ruled out. And once we get your spine tuned up, because the brain and the nerves control all the systems in the body, including our hormonal regulation, chances are you're going to have a really great result, especially if you start working with them with diet or some other lifestyle things that they're doing. I love that. I love when they can't find anything. I'm like, great. So hormonal issues are certainly a problem. They used to think endometriosis was a problem, but that didn't seem to be the case unless it was super severe. But some other ones might be infections, pelvic inflammatory disease, other illnesses, and pelvic surgeries and that type of thing. But what I really want to talk about are a couple of ones. And I know you want to talk about...
well, I've talked about... I mentioned a couple of things, that inflammation, right, thyroid, and insulin sensitivity and nutrition
right.
deficiencies.
So, I mean, we might want to talk a little bit more about those, but I did mention polycystic ovary syndrome, or PCOS, and I really want to talk about this one because it is becoming more prevalent, and generally this is happening with women who are overweight or obese. They have an intake of calories, which causes weight gain, which is related to the infertility. And what happens is that excess estrogen is produced by the fat cells, and that causes the hypothalamus. This is another part of the brain that actually dictates what the pituitary does, right?
It's a complicated system.
It's the big conductor, right? The pituitary sort of carries out the orders and tells everybody what to do, but the hypothalamus is really regulating everything. Including your temperature, go figure, which is what we're using to see in the fertility awareness system. So anyways, this the hypothalamus normally produces something called gonadotropin releasing factor. Or hormone, I should say. This is what tells the pituitary to release the FSH and the LH. So that extra estrogen stops the hypothalamus from doing that, and therefore the FSH is not produced, the follicle stimulating hormone, which then means that no egg starts developing in the ovary. There really is no ovulation that's taking place. And if you don't have ovulation and no egg release, there's no way you're getting pregnant, at least in the way of without any intervention. So these follicles turn into cysts instead, which is hence why you get the name polycystic ovary syndrome, poly meaning many. So what we found, or what's been out there in the literature, is the way to help women with polycystic ovary syndrome. And also typically you will find that high testosterone level as well. They tend to shift estrogen into testosterone, and this is where you get the acne, hair loss on the head, but maybe some hair growth on your face.
Thankfully, I didn't get
overweight, this type of thing. So we find that we want to lower another hormone in their system called prolactin, and we can do that by eliminating alcohol, marijuana, meat and dairy, which contain dioxins, which are hormone disrupting.
And is this all meat, or is it just red meat? Or
just animal products in general tend to concentrate dioxins. It actually is the biggest source of dioxins, which are hormone disrupting chemicals usually found in the herbicide industry, or whatever that is, the poison industry. Excess protein, so have them not eat so much protein. Have them not do too much strenuous exercise. And you may think, well, they're overweight. The exercise is going to help with that weight aspect. But if it's too strenuous, it also can increase cortisol in their body, which then can increase that holding on to the fat. So you want it to be moderate exercise. And things like B6 tend to help, as well as things like wild yams, which help support the progesterone system to help balance. Now, I tend to use things like saliva testing to check hormone levels. And usually when patients come in, I will check not only their female hormones, but also their cortisol. So I'll check on both. And how do we get onto this when we're talking about males? See, talk about detours. That's all right.
No, you wanted to talk about PCOS, which I think is a great topic. Yeah, because I have some stuff to say about that too, which ties into yours.
Great.
As well.
So yeah, you've got this whole system in place where if you can help a woman balance out her hormones, I do that with chiropractic, homeopathy, essential oils, diet, and exercise. So lifestyle changes to help with their system, then they're going to, and if they're checking their fertility awareness, they're going to start to see that they're actually ovulating, temperature increasing. So you can monitor those changes really easily by doing this fertility awareness method. And don't forget, if you're joining us, if you have questions, please let us know. Just type it in the comments, and so we can see and answer your questions. Did you have more to add about PCOS?
Well, I actually think it ties really nicely into the lifestyle factor. So when we're looking at polycystic ovarian syndrome, we've been looking a lot in the pediatrics program that I'm currently getting my certification through. They have a class on epigenetics. So there was a lot going on with the amount of insulin resistance that we're finding in today's society. And this is coming into that polycystic ovarian syndrome, or PCOS, as I'm just going to shorten it to. So here's the thing. Excess insulin, and I'll talk about what exactly that means in a moment, but excess insulin can interfere with ovulation. So because of this, the menstruation of the egg or follicle is often incomplete due to this excess estrogen. Sorry, not estrogen, excess insulin. We'll get into estrogen in a moment. But that can actually prohibit ovulation and at the same time increase ovarian cyst formation. So because this follicular development is often incomplete, the body is going to be told to make more follicles because there's something going on there. Therefore, too many follicles are created, and therefore you get the PCOS issue. And again, this is all coming from a potential increase in insulin. Now we're talking about increase in insulin secretion from the gland. And so of course you hear about this with diabetes type 2. However, when we're talking about diabetes type 2, I'm not just talking about somebody you would think typically with diabetes where they're really, really overweight. You can have somebody of a relatively small size have a normal, and this is normal by typical medical standards, a normal blood sugar glucose measurement, but they're not testing the insulin resistance. It's the insulin resistance that really matters when we're talking about this. So when we're talking about insulin, insulin's job is to move glucose, aka sugar, out of your blood and into your cells, into your body tissues to be used. So when your cells are overwhelmed by the amount of sugar that you have in the diet, they become resistant. They're like, we don't want this sugar. We don't want that amount in
Well, they become deaf.
Yeah,
the receptors on the cell are like, talk to the hand.
Yeah.
Like
they become resistant against the action of insulin itself. Hormones are a feedback loop. The body's not just going to go, oh, your body doesn't recognize it as resistant. It recognizes this as your insulin's not working. There's not enough for some reason. So we need to produce more. And it doesn't matter how much insulin you're going to produce. Your cells are deaf to it. Those receptors are affected. So it's just going to stay in the bloodstream. So
where it is not supposed to be.
Right. It's you feel chronically tired and your pancreas is working overtime because it is being told constantly to produce more insulin. So you can see how that cycles around where you just keep eating all that sugar, and it's staying in your bloodstream. And all that tells your body is the amount of insulin we're producing is not enough.
And it's very inflammatory.
Mm-hmm.
So you are going, it's like your system is on fire, and that includes your reproductive system, your brain, your gut. It's really one of those things that insulin resistance creates such havoc in the body. If you have this, really, yes, there are drugs that they can give you for this, but it doesn't take care of the ultimate issue or problem. So working with your lifestyle, working with someone like Dr. Toxel or myself, or someone who does integrative care is going to be the thing that is going to help you get through this a lot healthier, rather than just sort of masking the symptoms of what's going on. And this is what we're talking about.
And so speaking of masking the symptoms, I want to talk just a little bit about labs, and don't worry, I'll make it super simple. So typically what they measure is fasting blood sugar. So that's when you don't eat for a little bit. So they recognize that 87 milligrams per deciliter was an increased risk for diabetes, but most, and we're going to quote this, most physicians aren't concerned until it's over 110 to 126. They kind of vary. 126 is like, really, really
it's
bad.
way too high.
Way too high.
Way too high.
So that's when they start calling it diabetes. When it gets to that 110 or 126, it varies. But because of the way that your body is working, blood sugar is the last thing to register as high. Your insulin has to be raised first for that amount of sugar to be in the fasting blood, meaning that you haven't eaten. So when your blood sugar is high and you still haven't eaten anything in the past 24 hours, you're already in a pretty bad state.
Yep.
Why wait to get there?
So in other words, this is something that people who are trying to get pregnant,
Mm-hmm.
or especially if you are overweight, you do want to know what your levels are, because this does make a difference, not only for your fertility, but for your overall health and well-being. Blood sugar, keeping it at a minimal level or the optimal level is really one of the most important things you can do. Right.
So we as functional, physicians, when we're looking at optimal function, they call pre-diabetic around 100 100. That's the normal level that they call pre-diabetic. But at that point, you're already in a state where your insulin is spiked. So again, most people can have normal blood sugar when they get back these tests, but they have high insulin. The problem is that insulin is not tested for in these metabolic tests. Usually you have to specifically request it. And I think that's crazy that they don't include that.
Well, there's a lot of crazy things that go on. Same thing with the thyroid.
Yes.
Look, I'll have women come in and I'll say, how's your thyroid? Oh, they tested it. It's fine. Okay, well, let me see your lab tests. And I look at them, and all that they've tested for is TSH. This is thyroid stimulating hormone. Guess what? Produced by the pituitary. I said, all that tells me is that your pituitary is making thyroid stimulating hormone, and possibly in a good amount. All right, there's a little bit variation there too, because as a functional practitioner, I'm looking for a narrow window than labs that show, sort of right before and after disease states. So a thyroid panel is what's needed to look at your thyroid, because hypothyroidism is one of the causes of fertility. So this is definitely something that you want to know.
And before we get into that, because I actually want you to go into the whole thing with thyroid.
The whole thing?
Or maybe a little bit. I
have patience at some point today. I mean, we want to give people an overview.
Well, no, so here's why insulin and counterpart cortisol matter, and that's where we'll get into thyroid hormones. So insulin resistance, too much insulin, it tells your body to gain weight around the belly and this fat storage. That creates inflammation and it creates oxidative stress. So what do we release when we're stressed? We released cortisol. So cortisol does the opposite of insulin. It's supposed to stimulate taking sugar from the liver specifically and releasing it to the bloodstream. So you're raising your blood sugar. So when insulin goes up to lower blood sugar, cortisol also goes up to prevent hypoglycemia. It's a really weird thing that happens, but your cortisol also can go up when your insulin goes up. So high cortisol can decrease the effectiveness of thyroid hormone. And this is why balancing the thyroid requires you to look at insulin and cortisol. Segue into thyroid.
Yeah, and this is all true. This is why I do have patients come in. I look at their female hormones. I look at their cortisol levels. And for the female hormones, by the way, I can either do a screening of just a snapshot in time in that luteal phase, day 19 through 22, or we can actually look at hormone testing through saliva through the whole month cycle. And you test, I think it's like 11 or 13 times in it to see what's actually happening during the whole cycle. So you can get a lot of information with these home test kits that I can get to anybody in the US. And then with the thyroid, I want to make sure a full panel is done. I want to see T3, T4, reverse. So it's RT3 or reverse T3. I want to see possibly if there's any autoimmune responses to the thyroid, not just TSH. And so again, I can work with anybody who's in the US. There's different ways that I can have you get me that information and see if it's optimal. And then the same thing with the cortisol testing. I do that with saliva. So you can either, if you can't, if you don't want to use me or you've got someone local to you, these are basically the three really most important things to look at, as well as the fourth thing being what's happening with your blood sugar, as Dr. Toxelis said. So I think that gives people a good idea of what to look for, because there is that relationship of hypothyroidism and then this whole relationship with diabetes and sugar and PCOS and just, this whole relationship, but everything governed by the brain. And the brain, of course, is what we're all about here at Your Baby's Brilliant Brain.
Yes.
Because it dictates everything going on in the body. So guess what? There are instances of people who are split personality, like literally they are one person with one personality and another. One can be an insulin dependent diabetic. This is actually somebody who they don't produce it at all. They're born with it. And the other personality not have any issues with insulin production at all. This is the same person, the same body physiologically, but their brain is what is different in these different personalities. And I think that's absolutely fascinating and a way to illustrate that what is going on with our nervous system is essentially so powerful with how our body's functioning. So you can eat, great and moderate your stress, etc. But if you have subluxations going on in your body, I look at this as sort of like numero uno in causes of infertility, especially like I said, when there's just unknown pathology, like they can't find anything. But even if you have other things going on with your pancreas, with your digestive system, with your thyroid, all of that is under control of the brain. So again, as chiropractors, this is perfect because we can have you come in, we can assess your nervous system and your spinal column, make some adjustments, release any interference to that communication of the brain and the rest of the body, and have that free-flowing information going on. And I mean, really, sometimes that's enough. Of course, I'm always checking everything, but sometimes that can be sort of that cherry on top, especially if you're already doing so many great things for your health.
Right. Yep. So my recommendation to anybody, who's having fertility challenges, get to a chiropractor, especially one we specialize in pregnancy and she specializes in pediatrics because it is a lot of work with the pelvis and the sacrum. and all the ligaments and muscles that go along with it. So somebody with a really intrinsic understanding of that part of the body, aside with top of the head too, that very first cervical vertebra. So getting to a chiropractor. Second of all, you want to test for these things. You want to test your vitamin D3 levels. Now, didn't get a chance to go into that. I have a whole thing. We're probably going to have to part 2 this.
We should just talk about vitamin D sometime. It's so important.
So we'll do a whole thing on vitamin D, but you've got to get your vitamin D3 specifically checked. You've got to get your, we call it hemoglobin A1C. If you can't do the insulin specific test right now, that is going to give you a better reading of what your blood sugar is like a bit earlier on.
Well, and it gives a bigger picture. Yes. It's more, consider it like the storage form. It's sort of a accumulation over, I forget, is it like a month? I don't know. I forget the amount of time it is, but it's a better picture and a better indicator. And also they will say, oh, we like to see that number like 6 or lower. I like to see it definitely 5 or lower, maybe even 4 or lower. So
especially
lower the better.
You're having fertility challenges, because again, we're looking at insulin. So if you can't get a specific insulin test, which I think you have to add it on typically. If you do
most of the time they're not checking insulin. Right. So that's if you're doing a screening, you're going to get that hemoglobin A1C for sure.
And that's a better indicator. I mean, I have this whole other, we have so much more information to go into for optimal fertility.
I have pages and pages.
Yeah, I have pages too. So the main thing though
let's get some things to work with.
Yeah, to wrap it all up, this will give you a good idea.
That and remember, environmental wise for hormones, synthetic estrogens. All right, we talked about in depth about the birth control pill, but xenoestrogens are huge in our environment, especially in things like plastics. But don't forget about your home care products, your body care products, your cleaning products. A lot of the things women are putting on their body are creating infertility. So the creams, the lotions, the potions, the makeup, you have to go through and look at this stuff because it goes directly into your bloodstream.
So what would this estrogen be called? Because they don't just put estrogen.
Well, they're called xenoestrogens, and it can be in the form of, I did a really good in-depth talk about this that I'll put a link to on one of my YouTube shows, but anything in plastic as well, BPA or even other plasticizers are full of these estrogen compounds that are foreign that can either block estrogen or they can make more estrogen that your body's being exposed to. So just be aware of the things that you're bringing into your home that contain these toxins that you might not think about. And we talked a little bit about it too in our the Water Guys Inc. episode, so we can put a link to that as well. Right. But, again, I just want to go really quick back. Oh, by the way, smoking, alcohol, caffeine, really bad for, I could go into the detail, but basically
maybe we should do a part 2 because I have so much more to talk about.
Well, that's good. Always better to leave them wanting for more than falling asleep. Same thing with recreational drug use. But a little bit more on men, okay? Because I started talking about men as being a third of the issue. Usually it's the women that are coming in to see me, and I ask, has the man been, have they done a sperm analysis, a semen analysis? And when I hear no, I think, really? Are you kidding me? This is something that's non-invasive. It doesn't take long. It's not that expensive. You got to get the guy checked out. Like, even before anything goes on, you have to make sure that there's enough sperm, that they're moving properly, and that the morphology and what they look like is optimal. Because if it's not, forget it.
Well, and so now speaking again, so diabetes, again, huge problem in this country, and I'm talking diabetes type 2. It's a big issue for men who have diabetes because one of the biggest issues you see with fertility challenges is DNA damage to the sperm. So if you don't have really good sperm, you want both sides to be as optimal as possible. This could also contribute to lower semen levels in general, and also deletions in mitochondrial DNA of diabetic men's sperm cells. All these affect the development of the sperm. So of course there's going to be increased risk for fertility challenges, risk of miscarriages, and birth defects, because it takes two. You got an egg and a sperm.
Like we said in the beginning, the best egg meeting the best sperm.
Mm-hmm.
So
one other thing I just want to mention. So in terms of a common issue for men, cholesterol meds, those can interfere with fertility because cholesterol is actually needed to build your sperm. Cholesterol is a very necessary, part of our body. It's just an issue of when we have too much. There are different types of cholesterol. We need the good cholesterol. Again, we could talk so much more about a lot of this, but just in a nutshell, watch those cholesterol meds. They could be contributing.
Yes, you need cholesterol to make all your steroid hormones, which are your reproductive hormones. So if we didn't need cholesterol, our bodies wouldn't make it. We make cholesterol. All right. I don't eat any foods that contain cholesterol, but my body makes its own. So it is not the evil thing. Unfortunately, it is just doing its job when it's basically patching holes in damaged blood vessels. And it gets the bad rap. But why are those damaged blood vessels occurring in the first place? That's the inflammation, which usually comes from high blood sugar. High blood sugar, that is what's creating more heart disease than any cholesterol product or fat or, whatever. And so, again, I'm going to talk about for a year. Number one reason for low sperm count, by the way, is variceal, which is basically just varicose veins of the testicular region. Very easy to treat, just a little microsurgery. Number two are hormonal problems. So again, we can talk, years and years on all of this, but look at your toxin exposure. I'm going to do a shout out again for EMFs. Go to our podcast on EMFs, but think about this. Think about where the family jewels are in a guy and where they put their cell phone. Think about where they put their laptop. All right. They don't do any studies on what's going on with the reproductive aspect, but you have to understand that probably is not a good thing to have this electromagnetic frequency radiation right in the proximity of sperm that is continually replicating every 72 hours, I believe. Yep. Okay, so that's a huge problem, not only for guys, but women as well. Okay, same thing if you're carrying it in a purse that's down near your reproductive area or a laptop over your lap. And certainly do not stick your phone in your bra. I mean, it's right there. Also, your heart's right there. We're all about frequency. There's so much about frequency. And I have a really cool device that I just got in. I'm going to be showcasing on my personal YouTube channel tomorrow. So I'm going to give a shout out to that because it's my new fun toy, but it's based on frequency. And it goes through and it looks at all these body systems we've been just talking about: reproductive system, thyroid, pancreas, and also what would levels be like as if you were doing a blood test without actually doing it. It's so freaking cool. I love it. I love all this stuff, guys. This is what keeps me energized after 30 years. So if you are out there and you have any last questions, go ahead and type them in as we wrap this up. And if you are watching this after we broadcast and you have questions, we're going to put how to reach us in the description. So you can always reach out to us, ask us questions, tell us what you want to know, like what we didn't cover about this, because we have so much.
We have so much information. So we might need to do another part to this. So
absolutely. Yeah. Anything else you want to add to this?
Nope. Well, yes.
That won't take an hour.
No, it won't take an hour. I just want to summarize. It all comes back to lifestyle. Diet affects everything. Movement affects everything. We were made to move. All I can say is all of these health issues that we keep investigating, including fertility challenges, it all comes back to everything we're putting in our body and to everything that we're expressing or in most cases not expressing as in being sedentary. So once again, if this clicks with anybody, as it, sometimes things click with me, look at your diet, look at your lifestyle.
And then I would say, just to add to that, is look at your emotional status. I think we could possibly do just a full episode on looking at stress and fertility, given the fact that most women, if they weren't stressed going in, they certainly are stressed once they are not successful in getting pregnant. So there's a whole aspect to that I work with and have helped women. Yeah. I mean, seriously, guys. All right. So hopefully this has been helpful. If you liked what we had to say, give us a thumbs up on YouTube. Subscribe, because you never know when we'll post a video. Mm-hmm. And on our podcast soon, we will be releasing some of the video content as well. And share with your friends. Yes. Let them know about this, especially the ones are thinking about adding to their family. All right. Thanks so much for joining us.
Stay healthy.
Well, yeah.
Be healthy.
We'll see you next time. And check out our podcast on iTunes and Spotify.
All right. Bye.
Bye.